Welcome to TechPacks, your partner in advanced research and development. In this video, we will be presenting the details about one of the most demanding research projects titled ECC and Diffie-Hellman based hybrid approach for protecting medical data. This research project can be extended further to publish a research paper in a reputed journal or used for your PhD or MTech thesis. So, if you are a researcher, PhD, or MTech research scholar working on a similar research project and need expert guidance to handle the complexities of research in this field, you're in the right place. Watch this video till the end to gain valuable insights into the project's objectives, methodology, and results. We'll also provide a demo of the code in action, showcasing its key features and functionalities. So, let's begin. Our professional researcher will now take the lead and guide you through the details. Here we go.
Hello friends, welcome to TechPacks Research and Innovation Services. Today I am going to present you one of the applications that we have designed in the domain of the biomedical applications. It is related to the real-time for the data security in the hospitals and medical institutes. So let's move to the video. Before moving to the video, let's talk about that what we will cover into it. In this video, we will initially talk about the application areas in this which the developer approach can be useful. Then we will talk about whatever the code we have designed, how to execute it, which files we need to execute, and finally what are the software and library requirements for those. This will be followed by the current problem, other systems those are working in the same domain, problems identified in them, and what exactly we have done in the proposed work. Finally, an experimental outcomes and results will be discussed. So let's move to the application area. As I already told, the application that we have designed is specifically for the data security and sharing the data among the patient and the doctors for the healthcare institutes or the hospitals. So this is related to the biomedical applications, healthcare, medical care for the data protection and the security. Now let's move to the code. So the code that we are going to provide you will be the folder like this, under which there will be folder name code having all the files and related information. The whole data is developed in the MATLAB, so you must have the MATLAB software with you. The MATLAB version that I am using is R2019A, so you can use 2015 or the above version. In order to run the code, you just need to go to the folder where whole code is placed, just copy the path, go to the MATLAB and paste the path, press enter. You can see all the codes are available over there. In order to run the code, we have done it in the individual files, as well as we have developed and graphical user interface application for the demonstration for how it can be used in the healthcare institutes. So firstly, have looked the files that we need to run. So one is main palm.m, another one is main thumb.m, third one is res.comparison. So these are the generic files, those we have implemented in order to show the and analyze the results. Then for overall application, you just need to run the front.m file. Rest all files are the interconnected files with this graphical user interface. So firstly, whatever the file you need to run, you just need to select that, click on the run button, and it will start executing. So here you can see we have given the key sizes, and at end it will give us the result in terms of the time and the total time for the data generation, data conversion, encryption, decryption, each and every we have taken different times, right? So when I'm running it, it will start executing. In the meantime, let's talk about that what people are doing. Mostly the people are working in the domain of data encryption, where they are using the techniques like ECC, and then they have used like MD5, there is AES and many other algorithms. So the key generation methods for these method is quite simpler or are very complex. So there is a requirement that there should be a system that can work with encryption of the confidential data of the patient. Secondly, for the authorization purpose, there are very rare studies, those are available for those are working in the domain of biomedical things, including palm or the thumb. So most of the people are either using the fingerprint sensors or something. So here we have used the role of computer vision, where we are using the image impressions of their thumb or of their palm in order to generate a authorization key, and then doctor will be able to process the data of the patient assigned. So now let's conclude that what contributions we have made. The first contribution is like when the patient is submitting its data, that will be encrypted by using a hybrid model of Diffie-Hellman key and ECC encryption. In the second phase, for the authorization purpose, doctor have two things, one with the palm, another with the thumb. Any of one can be used, and then it get encrypted by using MD5 algorithm. So finally, when doctor want to access the data of the assigned patient, he has to give his thumb image impression or the palm image impression, whatever he have used for the authorization. On that behalf, it will decrypt the data, match it with the database. If it is matched, then only the author will be able to see the results. So as you can see, I just run the main palm where we have done the analysis by changing the key size. Here you can see, here you can write the key sizes, and we have run it for multiple cases so that an average results can be opted. Initially the data is being taken from the heart rate dataset, which we can get from the kaggle.com, and then palm images we have taken for the doctor. This is for the palm images, this is for the thumb images. The only difference between the two is the thumb fingerprint images and the thumb images. So two different types of images we have taken as a doctor authentication purpose. Then we have applied the key generation method through the Diffie-Hellman key. Then ECC encryption is applied. Later on, the patient data is processed, and whole data is out of whole data. The password is encrypted with the MD5 algorithm. So then after getting all the results, we are also calculating the different times and finally showing the results. So we have analyzed it for palm as well as for the thumb impressions, and then by changing the key sizes we have saved the results. As you can see here, I'm going to show you the results for the rest for the 128 key size and 192 key size, then 256 key size, and similarly for the palm images and so on. So when I'm running this code, you can see the results will be analyzed in the terms of factors that include data reading time, doctor validation time, key generation time, encryption, data saving time, data retrieve time, decryption, total time. So these are the factors we have considered for both the scenarios and analyzed that how the proposed system is performing. So here you can see traditional system was taking too much time when data is transmitting from transmitter to the end user, where in our system it is reducing the time. Similarly, we have done for 192, 128, 256 for palm images, 192, 128 for the palm images, and then compared for both palm and thumb images at the same time. Then you can see processing of the palm images is taking less time on an average, whereas thumb is taking much more time when compared in the initial stage of the attempts. So this we have considered for all the cases. And finally, individual stages time has been plotted with respect to the attempt. So total 10 attempts were made and saved the results in order to show the results, right? Now let's see the graphical user interface. You just need to click on the front button, front.m file. You will get, this is kind of a portal that we have designed by utilizing the scenario that we have designed. So here there are two options, one is sign up, another one is login. You can sign up as a doctor or a patient. When I click on the sign up, here you need to enter the details. Let's say Navdeep, contact number 78787878, user ID NAV, password NAV, user type. When you will click on this, you can see either patient or a doctor. I'm clicking as a patient, and then I'm giving the thumb impression of mine so that I can register my data. So here, this is fingerprints for the doctor, fingerprints for the patient, palm for the doctor, palm for the patient. So let's see, I'm giving the fingerprint for the patient. First one, open. Then I click on the register. The registration will be completed, and click on cancel. When I go back and then I click on login, you can see now and the login type as a patient, and then I need to give the same impression as I was given the one, and click on login. It will show me that my name was Navdeep, contact was this, my age. These are the factors that we have considered from the data set of the different patients, which we are allotting randomly when a person is uh, giving the information. This can also be further enhanced by giving the values by your own. Here the doctor assigned is ABC, right? So let's say okay, login. I've already registered in a similar way as a doctor. The patient name, doctor name was ABC, and it is again, and then I'm clicking on the doctor, thumb, go to fingerprint doc. So first one is selected as doc, and click on login. When I'm clicking on login, if any of the information that we are giving is not present in the system, then it will be not login. So in order to see the login details, we can check the information here in the two sections. One is the doctor data, another one is patient data. So doctor registration data is going to the doctor. This here I can see what is the user ID and password. So user ID is ASD, password is ASD, doctor as a doctor. Here the first, and login. You can see the login has been done. Here it will show me the list of the patient that I'm already having with me. Let's say Navdeep, which I just registered. When I click on the submit selected patient, this is the data that you can see, but this is not the actual data. This is the encrypted data. So in order to decrypt the data, I need to get key for the decryption, whatever the key I have given. So as my key was this, I click with open. It will decrypt the data and will show the actual information. Before closing it, I just want to show that in the front we have called two of the GUI. One is login. Here it is. Here you can see login.m, and second is register. So here it is register.m. So these are the different files which are called when we are clicking on the buttons. Similarly, when it get working, here you can see this was the GUI for the doctor level, where the patient and information can be seen, and this was as the patient level, where the patient information was seen. So everything is there, but you just need to run the front because every other files are connected with that. So this is all about the application. So the researchers or the cybersecurity persons or the hospital related, those are need their data to be secure and further research in the same domain, can contact us directly and can get that data.
Thank you for watching this video. We hope you found it informative and engaging. For more information about this research project and to get our consultancy services, click the link in the description below. At TechPacks, we offer comprehensive support for researchers, PhD, and MTech students in the fields of engineering and ICT. Our services include selection of research topic, helping you choose the right topic tailored to your interests and the latest trends. Synopsis preparation, crafting a clear and concise synopsis with well-defined objectives. Coding assistance, providing expert help with writing and optimizing code in various tools and platforms. Research paper writing, assisting in drafting and editing research papers to meet the highest academic standards. Dissertation writing, offering complete support for your dissertation, ensuring consistency and quality. Plagiarism check and removal, ensuring your work is original and free from plagiarism with advanced detection tools. We also offer customization services to meet your specific project needs. Whether you require a modification of an existing project or a completely new application, our team of experts is here to help. Don't forget to like, share, and subscribe to our channel for more updates on cutting-edge research projects and expert advice. Thank you for choosing TechPacks. We look forward to collaborating with you on your research journey.